Welcome everyone. Today we have got a very excellent speaker, Aruna Navathe from Atlanta. And as our ritual, we will start session with a very short meditation, and then Alka Deshpande will introduce Aruna. So today's meditation is about how to handle boredom. I am very much sure that each one of you must have faced boredom in day-to-day life, and sometimes it's in a major scale, sometimes it's in a minor scale. So boredom is something that everyone experience at
Is it
some.
about boredom or autism?
No. The meditation, 5 minutes
Okay.
meditation. Yeah, yeah. So the meditation is about how to handle boredom, and Arunatai's topic is about eating disorder. Alka will introduce that. Uh, so please sit comfortably. Feel your legs touching the ground. Feel your hands resting on your lap. You may gently close your eyes and come inside your body, letting go everything that you are doing till this point and you are going to do after this session. Having intention to be present here and now. Relaxing your body, relax your legs area, relax torso area, soften your tummy area, relax shoulders, relax your jaw area, soften your eye area. Feel your whole body sitting. And as you feel your body sitting, you will notice that body is breathing. Normal, natural breathing in, breathing out. We focus our attention on feeling sensations of body breathing in, body breathing out. You can feel it as a rhythm. And as we do this, it's very natural that there would be distraction, a thought, a memory, a image might come to your mind. If that happens and you notice that, gently noting it and coming back and feeling your body breathing in, body breathing out. It's very important how you talk to yourself when you feel distraction and come back to your breath.
Não, Carlos.
Also, investigating what is your mind state right now. Is it restless, bored, confused, or it's peaceful, joyful, whatever it is, just allow it as it is. And if we see what is boredom, emotion of boredom, you find that boredom is nothing but lack of our total attention, or we can call it as a half-hearted attention of mind, or not mindfulness of mind. So whenever you feel that there is a boredom, there is a way out of gathering your whole attention, having some interest, some curiosity, and focus it on whatever you are doing. For example, we are focusing our attention on breathing in, breathing out. Sometimes in a day-to-day life, there are some people that we don't feel connected, or we are not into the moment, or we feel bored to go ahead. So that time, if you can gather your attention, have some interest, let go resistance or attachment, and being in the moment wholeheartedly, we can find a way out of boredom. Feeling your body, feeling your bodily sensations of breathing in, breathing out. Having some interest, curiosity with gathered attention on breathing in, breathing out. And doesn't matter how many times there is distraction, how many times there are difficult emotions. Every time you realize that, you kindly let it go and kindly come back and feeling sensations of your body breathing in, body breathing out. Gently letting go focus on the breath, feeling your body sitting again, bringing some movement to your hands and legs, and once ready, slowly opening your eyes. Thank you for meditating with me today. And now I'll hand over mic to Alka Deshpande to introduce our speaker today.
Thank you so much, Anjali. That was beautiful, even relaxing the whole body, which was absolutely needed for today's talk. So today's speaker is Aruna Navathe. First of all, many, many thanks to her. We had gone to Atlanta in May because of Shri Yoga, because of Sabnis Kaka, and we got to meet Aruna Tai and Sham Kaka. They're absolutely fabulous hosts. And that's the time we actually came to know how talented she is. That talent was hidden for a very long time, and we did not know about that. So we are grateful, and also it's an honor for us to have you on the platform speaking for us today. So giving her information, the professional information. So Aruna has worked as a clinical dietitian for the last 35 years in the nutrition field in the hospital. She worked in Children's Healthcare of Atlanta for last 30 years. So it's a very, very experienced speaker we have today. She has earned her master's and bachelor's degree in nutrition and dietetics from New York University, bachelor's in home sciences or home economics at SNDT Bombay, India. She has written a chapter about nutrition and feeding difficulties in the developmental diseases with Dr. Cohen. She has varied interest. Apart from what she does, she has different interests of the in fields like nutrition. Of course, that's her main profession as well. She is also a sportswoman, and she is also a trained yoga teacher. She played inter-university kabaddi, which is that sport is now coming back again in the limelight, especially in India and Maharashtra, and volleyball. She's teaching easy yoga on Shri Yoga group from last 3 years with Sabnis Kaka. We all know about Shrikant Sabnis. And she's married to a professor, Shamkant Navathe. We call him Sham Kaka. She has two children, Manisha and Amol. They both are physicians. And we will be having her daughter soon on the platform. She's a pediatrician, so she'll be having her one of her talks on her platform soon. And she has 4 grandchildren. So today's topic is actually something which not many of us are open to discuss because of whatever kind of a burden we have in the society, because it's hard to have even a children or if a person who is going through such kind of distress or ailments, you call it as. And nutrition plays a very, very, very important role in this field because everything starts from your gut. Everything starts from what you eat and who you are. So with further delay, with no further delay, let's start introducing Ms. Navathe, Ms. Aruna Navathe, and the platform is all yours, Aruna. Thank you.
Thank you, Alka. It was a humble, wonderful introduction. Thank you. First, good morning, everybody. Welcome to the program. First, I want to thank you, BMM Self-Care and Meditation, for giving me this opportunity to discuss about nutrition and developmental disabilities and focusing on autism spectrum disorders. First, I want to thank Alka. She and I, we were discussing what topic to take. And she said nutrition is a good topic. And then I thought of developmental disabilities. And she said that's a fantastic topic because a lot of children are going through that. And we can concentrate or focus on autism. So we tossed around with different topics, but finally we arrived at autism. And I just want to mention that when I teach yoga on 11 o'clock on Tuesday, I saw one child, which is Kaushik, who was doing yoga, and his mother was helping him. And Madhumita today, she is in our audience, and later on she is going to give her perspective about autism also. And I really thank you for her for participating in that. Next one I want to thank you is Shrikant Sabniji. Because of him, I got introduced to yoga and Alka Deshpande and BMM and Self-Care Meditation Group. And we are learning many things from this group. They have several topics, and it is very educational and informative to all of us. So I really thank Shrikant Sabniji. And not but least, I want to thank my husband because he is always encourages me, always supports me in all the endeavors I take, and he sometimes kind of push me to do certain topics. One more audience is here, which is my colleague from Children's Healthcare of Atlanta, June Ridgeway. And I told her that, oh, I'm going to give the talk on autism spectrum. And last 5 years, I'm not working. So do you have any recent literature or recent articles to share with me? And immediately, without hesitation, she forwarded me a couple of current articles. So June, thank you very much. Now, let's turn to our nutrition and developmental disabilities topic. So let me first describe what is developmental disabilities. It is a severe chronic disability which is attributed to a mental and physical impairment, and it is usually manifests before the age of 8 years of age. And this will have a substantial functional limitations, 3 or more areas like self-care, repetitive and expressive languages, learning, mobility, self-direction, capacity for independent living, and economic sufficiency. They need interdisciplinary medical genetic care and treatment for social services for lifelong or sometimes it's extended period of duration. It has to be individualized, it has to be well planned, and at the same time it should be coordinated. So let me tell you about different types of developmental disabilities in short. Developmental diseases is a vast subject. It will take a long time to discuss or cover each topic. So I decided, Alka and I decided to focus on autism. So let's look at 5-6 developmental disabilities. Autism spectrum disorder is related to brain development. Cystic cerebral palsy is motor dysfunction, and there are 5 categories, but of course we won't go into low category that they are quite functioning and they are mobile. But at the 5th stage, they cannot mobile and they have lot of feeding difficulties. So nutrition plays a big role in cerebral palsy. Next is a spina bifida, which is neural tube defect. There is a cleft in vertebral column, so basically in spine. And if that defect is near the neck or the upper part of the spine, then they have a lot of feeding difficulties. If it is at the lower part of the spine, then they have mobility issues. So they may have to go through a lot of surgeries. Next one is trisomy 21, which is Down syndrome. It is a chromosomal disability, and they have typical characteristic features. And they are very happy-go-lucky people. They have low functioning, but they try to help. And I want to mention that in our Children's Healthcare of Atlanta, they had employed some Down syndrome. I'm going to call children, but they were adults, 18 and up. So they can do some smaller jobs like starting of the medical supplies and helping whatever you need to carry or clean up with the staff. So it is very important. And I had seen one of my friend's daughter had Down syndrome, and she usually goes to preschool and helps the children there. So they are low functioning, but they have a full life ahead of them. The last one is Prader-Willi syndrome. It is hyperphagia. That means you tend to eat a lot and then you gain weight, which causes obesity. So initially when they are real young, they are underweight. But as they grow older, because of their hyperphagia, they don't have control over their brain. So they tend to eat more and they gain weight. So all these symptoms have feeding issues, alter growth, drug and nutrient interaction, because they are on several medications. So we have to look at that. And some comorbidities also. So after that, let me focus on autism. It's a biological base, a common neurodevelopmental disorder. If you look at the CDC data, prevalence is 1 in 31 children at the age of 8 years. That is the current data in USA in 2025. But if you look at the old data in 2017, it used to be 1 in 36. Why is that? It's because there is a increased awareness and the testing has improved. So that's why it makes a difference. And if you look at the worldwide data, 1 in hundreds were diagnosed between 2012 and 2021, according to World Health Organization. It is more common in boys. It's almost 3 to 4 times common in boys than girls. And now these children are going to go into adulthood. So if you look at the adult data according to CDC, in 2017, 1 in 45 adults had autism. So it's almost like 21%. Autism begins in early childhood over time, and it can cause difficulty in functioning in society. Each child has unique pattern of behavior. Each child is different. So let me describe some characteristics. It is very difficult for them to interact in and communicate in society. They usually have non-verbal communication or verbal communication, or they throw tantrum. They are very aggressive. They may not be aggressive towards others, but they hit themselves, or they don't have any eye contact. They have a lot of times rocking or spinning or hand flapping repetitive behaviors. They have a sensory processing differences. That means smell, taste, texture, temperature, they are very sensitive to that. And at the same time, there are some children are very sensitive to light and sound. They cannot tolerate any large sound or loud sound. And because they have sensitivity to smell, taste, and textures and temperature, they become picky eaters, and what we call is selective eating. And as they grow older, some children interact more and they have less behavioral problems. I want to emphasize about vaccine and autism. There is a lot of research studies are done, and the meta-analysis indicates there is no link between vaccine and autism. Now, etiology is unknown. There are many causes that people are thinking or researchers are thinking. There could be genetic, environmental factors, viral infection, complications during pregnancy, air pollutants, or it could be medication. We don't know the reasons. And sometimes they co-occurs with any other health issues like attention deficit disorder, attention deficit hyperactivity disorder, or some children have intellectual disability also. They have sleep disorder deficiencies. Then they have OCD, which is obsessive compulsive disorder. And I want to mention there are 3 levels of autism. The first levels is requiring support, which is very low level. And the other one is substantial support. And the third level is very substantial supports. So these children face unique feeding issues, unique behavioral issues. And usually what I mentioned about those 3 levels are their general guidelines. So now let me elaborate about what I mean. I mean, not eating a well-balanced diet. They have no specific standard diet for autism. Nutrient needs are the same as healthy children. Their main problem is poor and restricted intake. They are not eating well-balanced diet at all. So let me elaborate on not eating a well-balanced diet. They have a lot of nutritional challenges. First of all, they are picky eating. Then they are sensory sensitivities. As I mentioned before, they have a lot of GI problems, gut health problems. They have feeding issues, compulsive eating. Gagging means they eat something and the food gets stuck in their throat, so they try to gag. Then pica. What is pica? Pica is non-food items. That when I was working in Gainesville, Florida, I was working one time in a mental retardation institution where I had some couple of autistic kids. They were eating nuts and bolts. So we have to be really watchful, see what they are eating. Some of them had rumination issues. So they eat everything and then gurge it back, chew it, and then again swallow it. So let me little bit elaborate on feeding issues, which is digestive issues. Usually they may have diarrhea or constipation, they vomit, or they may have bloating. And they have very strong reactions to food, smell, and taste that I mentioned already. Then they may have leaky gut. I want to little bit elaborate on leaky gut because that is also a controversial issue. Some physicians or some school of thoughts they feel that leaky gut is not a real diagnosis. But other school of thought, they think the leaky gut is a diagnosis. So what does it mean? Leaky gut is, they feel a hypothetical condition for some physicians. intestine forms, whenever you eat, intestine forms the tight barrier that controls and gets absorbed into the bloodstream. So we absorb all the nutrients, but the intestine acts as a barrier for toxins and undigested food and bacteria. So when intestine becomes unhealthy, when gut becomes unhealthy, it is the lining becomes porous, and it permeates and allows partially digested food and toxin and bugs, bacteria, and gets into the tissue. And that may trigger inflammation and changes in the gut flora and could lead to the digestive problems. Then there is weight concerns, because some of them don't gain weight, or some of them gain too much weight because they try to eat the same type of food. Then we have to nutrition, because then they develop nutrition deficiency. Some of them have high metabolism. And as I mentioned before, it involves gut and our metabolic system. Now, I would like to share a nice quote with you about nutrition. The nutrition problems typically do not announce their presence. They must be sought. That means you have to really look for it. And this quote I found in Nutrition Today in 1969 journal. So nutrition is an integral part of growth, development of children, and maintain body functions at all the ages. So let me go over the assessment of nutritional status. So I'm a dietitian, and from my perspective, or if you are going to visit a dietitian, or somebody is going to visit a dietitian or a professional, what type of questions you will ask, or how would you approach it, these nutritional problems? So first of all, the first is anthropometric measurements, which is height, weight, growth velocity, height velocity, and BMI. Then we have to look at what other problems they have, what is their medical history. We have to look at their lab data, their all metabolic lab work, and organic acid test. Alka mentioned that, please mention this organic acid test. It's basically a urine test which analyzes organic acid, which is metabolized by byproducts, to assess the body functions and identify balances of our dysfunctions in the body. So some pediatricians do this organic acid test, and some physicians don't. But most of the time, all developmental disease physicians lot of times order this organic acid test. Now you have to look at medications, because they may be on different medications because of some comorbidities. So it may have some side effects. Then if they are taking in dietary supplements, we have to look at if there is any dietary supplement and nutrient interaction. We have to look at their allergies and intolerances and access to food. I want to mention about access to food, because sometimes when I counsel the patient in the hospital, I talked to the parents, and they mentioned that, Aruna, I don't have regular grocery stores in my area. So even if you are recommending eat more fruits and vegetables, they don't have access to that. So in small villages or small cities, there may be a question of access to food. There we have to look at their physical activity, type of physical activity, physical activity, then TV screen and time, complementary therapies if they are getting. So we have to look at the overall picture. The major nutritional status assessment from nutrition point of view is diet history. So we obtain diet history. It could be 1-day diet history, 3-day or 7-day diet history. So we ask them to keep a food record, food journal, and look at their meal pattern, snack pattern, what time they are eating, what they are eating, how much they are eating, are they skipping in meals in the morning. If they have constipation issues or GI issues, lot of children are not hungry in the morning for breakfast, and some of them go to school, so that may cause some concentration problems. So we look at that. How is their appetite during the day? Are they are drinking enough fluids or not? What type of fluids they are eating? Are they avoiding any foods? So that all factors come into a picture, and are they picky eaters also? So we have to look at that. Now, once we look at all the factors, we have to analyze the data. In hospital settings, we have computerized analysis tools. So we can put the data in the computer and look at the analysis and estimate about their micronutrients and micronutrients, which is macronutrients is like protein, carbohydrate, fat, and micronutrients is like vitamins and mineral intake. So we have to estimate those. We have to estimate their fluid intake. So then arrive at nutrition diagnosis. So what we do in nutrition, how we arrive at nutrition diagnosis is we look at the nutrition intake and we compare that intake to requirements. So now what is requirements? Requirements are based on standard derived by Council of Nutrition with member council national academies, which could be medical, scientific, and engineering national academics. So they arrive at the standards and the requirements, and we compare their intake to their requirements and see whether it is negatively affecting their growth and development or not, and what are the relative outcomes. Now, once we look at that, then we arrive at nutritional deficiencies. What is an inadequate intake? So commonly in autism children, it's usually zinc, iron, vitamin D, calcium, vitamin B12, selenium, because of their growth issues, whether they are not getting eating a well-balanced diet, they are not getting enough calories or protein. So that affects their growth. And when their growth is affected, what happens? Entire family, the child as well as mother, and of course siblings are also equally involved, they get stressed out. And it's a lot of emotional and psychologically impact on the entire family. So let's look at the overall treatment for autism. First of all, I mentioned that you have to identify and minimize the core deficit of nutrients, optimize nutrition intake to meet the nutrition need, minimize and eliminate behavioral issues with eating, promote functional dependence. And what is functional dependence? Is basically daily living skills, whether they can dress themselves, whether they can go to bathroom, can they eat by themselves. These are basic daily living skills. Can they do exercise by themselves? So these are the functional dependence. So we have to promote that in the long run. Basically, with all these 4 factors, basic idea is to improve and promote the quality of life for the individual family. So once you look at this goal, now we have to put everything together. So we have to manage that and we have to treat that patients. So how do we do that? But some points you have to remember is autism being a chronic condition, it requires multidisciplinary treatment approach. It's you need to have doctors and psychologists and speech and occupational therapists and dietitians to consult with. And what you have to remember, it has to be, or it must be individualized according to their age. according to their requirements. And prognosis and outcome vary depending on the severity of symptom, whether they are level 1 or level 3. So depending on that, we have to make the prognosis and outcome. Now, the good news is that a well-balanced diet, wholesome diet, can generally improve the health and behavior of the child of autistic kids. It's not only autistic kid. In general, for anybody, we have to make sure that eat a well-balanced diet. Proper nutrition support brain development and cognitive function and emotional regulation also. It improves the concentration and stress and anxiety level. So if children don't eat the breakfast before they go to school, sometimes they cannot concentrate. They're stressed out. And some of them have some behavioral issues. So that's why it is very, very important to have a well-balanced diet and proper nutrition. I want to mention here about Indian diets before I go into balanced diet. If you really look at Indian diet, vegetarian diet, because I'm going to emphasize a little bit on vegetarianism also at the same time, it is really a well-balanced diet. Because if you look at it, in the plate, we usually have salt in the center. Then on the left side, we have some chutneys, which could be flaxseed chutney or coconut chutney or any other chutneys. On the side, a salad, or we call kachumbar or raita. And then on the right side, you have vegetables or lentils or dal or what we call amti, and some vegetables, leafy vegetables. And then first we may eat rice with the dal, or then chapatis or rotis. And then yogurt. Last thing is usually yogurt and rice. So you get probiotics also at the same time. And the tak, what we call is buttermilk. So we may have that, and along with water. So it is very, very well-balanced diet. So now let's look at each individual nutrients, which is protein. We have to make sure that it is high quality protein. I have already included lean meat and fish, because some of them may be non-vegetarians and they may eat meat, chicken and fish or poultry. But dal, legumes, tofu and dairy is good nutrition, and particularly dal, if you combine with rice and carbohydrate or roti, you get complete proteins. Now, next thing is vitamins, minerals. You get it from fruits and vegetables and leafy vegetables. Healthy fats, olive oil, peanut oil, cold press oils, chia and flax seeds, nuts, and fish. I want to mention about healthy fats, which supports the brain development. Fruits and vegetables, you get a lot of minerals and vitamins. Now, the second thing is carbohydrate, which is a complex carbohydrate. We want to encourage more whole grain products, brown rice or millets and whole grains, which provides us fiber and vitamin B and niacin. Then we want to limit processed foods high in artificial colors and preservatives and corn syrup. We will need to read the labels and a list of ingredients if you are using any packaged foods. We have to make sure that hydration is important. We have to make sure they are getting enough water and enough drinks. But what we have to remember is you have to limit sugary fruit drinks, but there is only sugar, nothing else. So we have to limit that and encourage water. Now, so bottom line is a nutrition-dense, balanced diet is a foundation. One can see improvement in child's concentration, sleep, language, And when they get nutritional status and get adequate nutrition and improves their nutritional status. Now, I'm going to discuss about autism and special diets. Does it work? Evidence is mixed, but for some children, it works well, and some children, it may not. So not all approaches work for each child. So I want to go over with little bit gluten-free and casein-free diet. We usually recommend that if they are allergic or if they have intolerance, then only you omit these foods, or you go for gluten-free and casein-free diets. Now I want to elaborate a little bit on gluten-free and casein-free, because some parents think it is normal to exclude one food group because it really doesn't cause any side effects. And it's okay without side effects, so it's okay to accept it. Other concept is they think that it's these foods are not fully digested, and then they can produce some peptide, short chain peptide fragments that act as opiates in the brain, which worsens the autistic symptoms. So that's why they try that. But I know that some of the children have tried gluten-free and casein-free diet, and we can see the improvement in their behavior. But now question is whether we need to consider a long time or short time. It depends on their the child, parents, and the physician. So that's how they are going to make a decision. The next thing is ketogenic diet, high fat diet, which is high fat and low carbohydrate diet. Now, it is not proven for autistic children, but it is well proven for a seizure disorder. So in our hospital, we have a team, ketogenic team, where the neurologist, dietitian, nurses are involved, and we prescribe ketogenic diet. But we have to be very careful. It has to be medically supervised. Now, there are additional supplements like vitamin D, omega. If you notice that they have any deficiency, then definitely we need to prescribe those supplements. So what I wanted to mention about restrictive diet, it can cause a deficiency. So that's why you have to be very careful, and we have to consult the dietitians and medical professionals. Now, how do we create a personalized diet? So I have given some tips here for picky eating. So regular meal times and other strategies help children with autism learn a good behavior and make meals enjoyable for the family. So we want to establish regular routine and structure, establish a regular meal schedule, allow them to have 15 to 30 minutes only for meals, because I had seen some children take almost 1 hour to eat. And that just, it's a toll on the mother and the child. And if you look at it from the nutritional perspective, they get only few calories. So there is no pointing in delaying their meal time. Just 15 to 30 minutes. A lot of times I used to advise them, after 30 minutes, just pick up the plate, put it in the refrigerator. After 2 hours or 3 hours, warm up the plate, and again offer them that food as a snack, or that meal as a snack. Offer food from 5 food groups, which is fruits, vegetables, grains, protein, and dairy. That means it's a well balanced meal. For meals, at least include 3 food groups for it, because they are so picky. So we want to be little bit perspective about that and give only at least important 3 nutrients for them. At least we want to make sure they are getting enough calories. Avoid snacking between meals, because If they eat large snack, they may not eat the entire meal, and they may not get enough calories and protein. And I wanted to talk about schedule. I usually suggest them to put it on the refrigerator on the wall where the kids can see it and the parents can see and follow the schedule. The idea is we want to encourage them to eat healthy foods. And usually I suggest them to maintain food record, food diary, and see what food gives what reaction, how much they are eating, what they are eating, and then try to find if there is any correlation. If you restrict this food and if you give this food, so try to find out basic correlation. So structuring meal time will help it create a positive environment. What you have to remember is practice and patience will help overcome the challenges. So what we suggest again, a gradual introduction of food, one new food at a time. Because they are so sensitive to taste food, we want to make food visually attractive to them. So we have to make a fun activity around meals so that kids can get interested in food. So involve them in child food preparation, ask them to cut vegetables or ask them to wash the vegetables and help them cook. Like even stirring is like a cooking. So they are basically smelling the food. So they become desensitized. They are touching the food. So if they are tactile defensive, then once they touch the food, they feel comfortable with that. And this helps with food acceptance. So we basically what we are doing is creating a positive environment around them, around food and around them. So, and calm and positive attitude makes a big difference. We have to stay calm. We have to ask the kids also to stay calm and take positive steps. And if they have 1 or 2 bites of food, praise them for that attempt, because it takes 15 to 20 tries to accept the food, and offer new foods with favorite foods. So a general health food individual diet support the growth development, and we need to support optimal brain function, physical health, and quality of life. So now let's switch the gears. Let's look at behavioral and cultural consideration. I'm a nutritionist, so I have just mentioned some of the behavioral programs here. June had sent me a couple of articles, so I included some of the behavioral programs in this. So let's look at behavioral issue first, and then we'll look at cultural consideration. Now, when you look at the behavioral intervention program, we have to make sure they are evidence-based, so it can make a difference. I have put in 4 programs here, but there are probably more programs available in the community. So we can look for those programs and follow that. So for the first program is Parent-Mediated Behavioral Intervention, Applied Behavioral Analytic, which is ABA intervention program, Cognitive Behavioral Therapy, CBT. This is quite common for behavioral therapies, and family center models, because the trainer goes to the family and trains the entire family, not only the parents, but the entire family, the siblings also. So, and I have provided the detailed information on these programs at the end of my presentation slides. So if you look at these evidence-based behavioral intervention programs, they are all structured programs. The caregivers are trained, and it is usually 12 to 14 week sessions. It focuses on positive child behavior. Goals is to promote better food acceptance, increase the variety of food, food flexibility, and less problem behavior around mealtime or food. The trainers are usually speech therapists, occupational therapists, behavioral analysts, and who are trained to coach the parents. So even these therapists are trained for this programs. And of course, a dietitian can help with meal planning, giving them suggestions what foods to add, what foods will create any issues. So dietitian makes the contribution in that regard. And the success of intervention depends on individualized meal plan and parents' involvement, and of course, child's severity of level. So now, where can we find this intervention program? First of all, we have to discuss with pediatricians, neurologists, clinical psychologists, developmental behavioral pediatricians, and contacting local autism support organization. And I have listed the list. So let's skip this. But speech therapist, occupational therapist, dietitian can provide you that information. Now, let's change the gear and discussed about alternative and integrative medicine therapies for autism. The basic goal of integrated medicine or alternative therapies is to stimulate multiple domain of functioning, cognitive, social, and gross motor skills in children with autism. American Association of Pediatric has a council on autism, and they have come up with these three categories and grouped together, which is one, natural products, including herbs, vitamins, minerals, and probiotics. Second is mind and body practices, including yoga, chiropractic, massage, occupational acupuncture, progressive relaxation, guided therapy, and pet therapy. And other therapies include like traditional medicine and neuropathy. So today's audience is largely from India, and many Indians moved to USA or this country in the last several decades or several years. So let's look at some cultural factors with Indian families. There are some beliefs that boys talk late. Their boys are naughty. They're allowed to make danga or throw tantrum, be naughty. They are hyperactivity, or they have some language confusion. It's okay because you are in this country, so you are exposed to English and your mother tongue. So it can cause that problem. Or this child is very quiet, and it is acceptable that some childs are and they speak late. So these are kind of factors that delays diagnosis. And other factors like stigma, because in our society, we feel that it is stigma. Why should we discuss with other people that we have this issue? And then we go through the denial phase. Why me? Why this is happening to me? Or why my child? So these are some of the traditional beliefs. We have to try to see from the scientific understanding or scientific point of view, see what are the benefits of this and understand what's going on. So coincidentally, last Sunday, I came across this recent article on autism from India Abroad newspaper, which is the silent struggle Indian families navigating autism in America, which is in India Abroad newspaper, Sunday, July 27, 2025. Basically, they also mentioned about families feel isolated. There is a cultural disconnect and stigma, diagnosis and denial, because diagnosis get delayed. And there is a lack of awareness. And when this happens, because you are alone, you are away from the family. So there's a lot of emotional burnout. So what we have to look for is support group, online support group. Then we have to make sure that advocacy is growing. The parents have to be vocal about it. The fact that we are discussing this topic today is a positive step forward. It means we are creating a more accepting world for our children. So as I mentioned before, that we are away from the family, so there is a lot of parental stress, and there is a lot of confusion. So what we have to do is seek help. We should not feel guilty because they think, why me? Why this is happening? And they feel sad about it. But instead of feeling sad, I know it is difficult for me to say, but be open about it. Feel normal and break the isolation and join the support group. Look for the family support. We need to educate the family. We need to involve family, and the self-care is also important, because if you are feeling good, you can provide the better care for your child and the family, because a lot of times parents are holding multiple hats on the head. So that's why we have to be very careful, and do not hesitate for ask for help. It takes a village to raise a child. And remember, you are not alone. You have to break that isolation and look for the support. Now, let's next slide. So if you look at, now I have looked at nutrition factors, behavioral factors, emotional factors, and psychological factors. So I had already discussed that goals for overall treatment in autism. Basically, we are identifying, minimizing core deficit of nutrients, optimizing nutritional intake, minimize or eliminate behavioral issues with eating, promote functional independence, and improve the quality of life. Do not hesitate to involve the dietitian and feeding therapist and professional guidance. Now, I'm going to invite Madhumita Venkatraman. Madhumita, please unmute yourself. I'm going to ask her to give her perspective. She is a dedicated mother and advocate. She is an active Toastmaster. She is an excellent speaker. She is an engineer and IT professional, and will share her powerful journey parenting of a non-speaking autistic child and comorbidities, and a second child born with a swallowing difficulties. So Madhumita, please welcome to the program, and I just introduce you to the audience, and I really thank you for very much for the participating. Can I ask you a few questions? We'll have about 15-20 minutes for this interactive session, and afterwards we can open a general discussion with the audience. So may I start, please?
Before that, let me give a little bit of about my journey so people know where I'm coming from before you ask me questions, if that's okay.
Okay, go ahead.
So one suggestion, we can stop the screen share.
Yeah. Okay.
Okay.
Thanks, everyone. Thanks for being here today. As Ms. Aruna mentioned, I'm a mother, caregiver, and an advocate for 2 children with unique needs. And I'm honored to share my journey with you all today. My older child is a non-speaking autistic teen with SANS panda. It's a pediatric autoimmune condition that causes sudden and severe neurological symptoms. And my younger child was born with EATEF, that is esophageal atresia and tracheoesophageal fistula. And it's a condition where the esophagus doesn't develop properly and is disconnected from stomach, but was connected to their lungs. She was unable to swallow at her birth and was choking on my own breast milk. And she needed immediate attention and surgery right after her birth just to survive. So when I was talking about the nutrition, Ms. Aruna covered all those things, but I'm not talking about just healthy eating and picky habits. I'm talking about survival, healing, and how the food became central for both my children's life in totally different ways, but in a very equally important situations. So when my older child was diagnosed with autism, we focused our attention towards speech therapy, occupational therapy, and all those traditionally advised, all those standard recommendations. But he was eating milk bikis and good day bikis and thriving in milk. So we didn't literally pay attention to the food and nutrition at the first place. And over a period of time, one day he was learning, he was still developing skills, but he lost all of them right in overnight change. One day he was calm and joyful, and the next day it was like someone flipped a switch and we started noticing sudden urinary frequency, incontinence, separation anxiety, regression, complete withdrawal, tics, OCD that was periodical and cyclical that happens in relation to the seasons, and all these things out of nowhere. And we later learned that he had pants pandas, and his immune system was attacking his brain after infections. And it explained why that overnight change and the fear in his eyes when he couldn't explain what was happening inside his body. Poor non-speaking at the situation caused even more trouble. Yet, even with a name for it, the treatment was not simple. We tried several antibiotics, anti-inflammatories, numerous supplements, and more, but something that surprisingly stood out for me was food. For a mom, you follow your instincts, and mine kept telling me that what he was eating was causing trouble and was affecting his brain and behavior. So I started learning about gut and brain connection and how often the gut is called your second brain because it produces neurotransmitters like serotonin and often regulates the mood and focus and even your immune response, as Aruna mentioned about leaky gut, by constantly communicating with the brain. And for my son, removing gluten and dairy and sugar reduced inflammation. Taking out artificial food dyes and preservatives made a noticeable difference in his behavior. And when we added healthy fats like avocado, olive oil, and coconut oil to support his brain health, and magnesium to help with the sleep, and probiotic, when carefully done, can improve your digestion and mood. And as you mentioned, zinc being a common deficiency in children with autism, that also supports immunity. When I did all these things, was it easy? No. Feeding a child itself is a challenge, but when you're taking into a factor of feeding a child who's non-speaking with sensitive gut, was anything but easy. But the impact it made in his development was made the effort worth. So nutrition for us didn't cure anything, but it gave him a well-regulated body to live in that supported his therapies, helped in his learning by reducing his flares, and helped in his sleep. Then again, my second child, born with EATEF, she couldn't swallow, and breast milk was not even an option. She tried, her initial life was totally relied on TP, and that is the total parenteral nutrition for first few weeks of life. I suddenly had to learn how to measure her intake and her pain symptoms, for she had a major surgery at her birth, and to administer feeds and prevent reflexes, and to know the signs of choking and aspiration. And when through all these experience, I realized nutrition is life, especially when you throw in a factor of developmental and medical challenges. Every single nutrient starts mattering. We eventually moved her to a more blended diet that is more pureed, real whole foods, so she doesn't choke, and work on avoiding acid reflexes so she doesn't develop stricture at the surgical site. And just like what I noticed with my older child, the choice of food that we make directly impacted her energy, growth, and development. And I didn't expect to learn about this feeding routines and medical diets, gut-brain connection when I picked up the motherhood journey. But when your kids face the challenges, you quickly become full-time researcher, advocating, and sometimes even become nutrition detective in collaboration with many medical experts. Say, for example, Ms. Aruna mentioned about iron deficiency, pica. Pica can also be related to zinc deficiency as well as iron deficiency, and the sleeplessness or insomnia could be easily magnesium deficiency or adrenal fatigue, and all these things came out of my experience. What helped was a complete journaling. I started journaling each and every symptom that they had in relation to the food that they were eating. And I religiously followed it with my experiences and collaboration with the doctors. So out of both this journey with these two children, if I had to learn one thing, it is the nutrition isn't just important. As Ms. Aruna said, it is the foundational. Especially when you're following restricted diet, even more scrutiny is needed to keep your food well balanced.
Yeah.
And more importantly, not all the supplements are made equally. So you need to sort out for more quality.
Madhumita, I really agree with you on all the issues and nutrition and everything you have mentioned. I would like to ask one last question. Can you suggest some therapies to the audience, or if you have done some therapies specifically? I know you mentioned about supplement that you have tried cold pressed oils and omega-3. So do you want to elaborate a little bit on therapies if you have done anything? Because then we will have some time for question and answers.
So let me wrap it up. So with the therapies, food is the foundation, but then that is the beginning for you to be moving forward. So what come into the factor from the food and after the medical support was also alternative therapies like speech therapy and occupational therapy, which at the base is yoga. So I realized yoga is the way of life to follow through, and I very recently embraced it into my child's life to bring in more support in his flexibility and body development. And that improved along with the nutrition regimen and therapy that pulled us out of and put us in the right track towards proper development. Did it make sense? You're muted.
You are
Ms.
muted.
Aruna.
You are muted, Aruna.
Yeah. Yes. I agree with you, Madhumita. Yoga makes a big difference. 1 minute, I'm having some issues with my slides. Yeah, okay. So, yes, Madhumita, you have really gone through a very difficult situation and experience, and I really appreciate that you have done so much research. So that's why I mentioned that parent education is so important, because you are getting this information, you are doing research on our own, you talk to so many doctors and therapists, so that you can have some success in your child's health. So the communication skills are important. Mealtime behavioral management also you have really tried well. So that is also a very important point. The consistent mealtime and multidisciplinary approach as professionals and guidance is required. So then you can act upon it and then make a difference in the life. Family support is also very important. So these are the key factors influencing the success. So I want to give everybody a message of hope that autism is a journey and it has ups and downs, and many autistic children can lead a fulfilling life, and we need to give them early support, the early detection, so we can give them that environment, we can give their choices and improve so they can thrive. So the summary and takeaway points are basically no specific diet for autism. However, because you know your child, so you can make few adjustments to your diet and provide a child a well-balanced diet. And that's the key. You are making an effort, you are keeping record and provide them healthy choices. So healthy lifestyle is also important. As I mentioned, yoga, meditation, and this type of support definitely helps. Sensory integration, that helps. And the whole child body approach makes a big difference because that supports body, mind, and the spirit. So family-centered individualized care plan, and this is the approach to the key. So we need to provide emotional support, inner well-being, focus on health and exercise, nurture the child with small steps at a time, and lead to a big changes. So I have given you a couple of references here, and I have added also link to current literature, so you can look at that later on at your convenience. These are the two slides about that. And I really want to thank you for all your attention. And thank you, Madhumita, for sharing your incredible journey with us. And I want to thank BMM and Self-Care Meditation team for giving me this opportunity to give the presentation on developmental disabilities and focusing on autism. If you have any questions for Madhumita or me, please feel free to ask. And as I mentioned before, healthy eating habits, well-balanced diet, considering all the factors, what is happening to your child, that makes a big difference. I really want to thank all of you. If you look at these extra material slides, I have included that. About complementary therapies. There are some gaps in literature because there are some lack of studies on adolescents and adults, or we don't have any long-term follow-up data, and need for generalization across the setting. I just added a couple of slides about selective eating and ARFID, which is avoidant restrictive food intake disorder, just for your information. And those 4 slides I have mentioned about parent mediator intervention meal plan, applied behavioral analytics, cognitive behavioral therapy buffet program, family center intervention EATUP program, and how to find EATUP providers. So this type of information I have included. So you can please look at it. And now we can open up for questions. And these PDF files I have given to Alka, so Alka will be able to forward if somebody is interested in this topic. And this makes a really big difference. And thank you for attending this. And I hope this discussion empowers you a little bit more in your path, and we can, all of us can, as a community, make a difference of the awareness of this autism. And thank you very much. So let's open up for questions.
Thank you, Aruna Tai. Thank you very much. This was a very, very informative session. And we do have a couple of questions. But before we go to questions, I am going to let Anagha Tai talk because she has to leave and she's going to announce next week's session. So after she's done talking, we will go back to the questions. But thank you very much.
Okay. Thank you, Aruna Navathe, पहिल्यांदा. And thank you, Saili, for giving me this time to talk about the next session. And the next session is by Dr. Prabha Datar. She has a PhD in Santa Apule Jivana. आणि मी मराठीत बोलते कारण ते सेशन मराठीत असणार आहे. संत अफुलं जीवन, आणि त्यांनी महाराष्ट्रातल्या 5 संतांचा अभ्यास केलाय. त्यांचं चरित्र, साहित्य, तत्वज्ञान, तरुण पिढीचे नाते यांचा सगळ्याचा अभ्यास आहे आणि त्यांना अनेक पुरस्कार मिळालेले आहेत. मी सगळे सांगू शकत नाही, पण एक सध्या राज्यस्तरीयवर कर्तृत्ववान महिला नारी पुरस्कार मिळालाय. आणि दुसरं म्हणजे 2023 मध्ये नवदुर्गा पुरस्कार मिळालाय. तर असं व्हेरी कव्हेटेड अवॉर्ड शी हॅज गॉट. आणि मी अतिशय गोड आवाजात त्या सांगतात, तेव्हा जरूर या. आणि तर आपण संत बहिणाबाईंचं चरित्र त्यांच्या तोंडून आणि त्यांचे काव्य ऐकणार आहोत. थँक्यू.
Thank you so much, Anaghatai. And before we go further, Saili, there is a small thing I'd like to add here. In our area, basically, as I mentioned, Dipali is one of the teachers here who had worked for does work for the special need children. And so today is a friendship day. So basically, there is one more person here, Beena Kurade. She is actually one of our BMM representative as well. If you both are here, Dipali and Beena, can you please just turn on your cameras, because they are been working in this field from last, I don't know how many years. And teachers are the first friends when it comes to the special need kids, because almost 7 to 8 hours in a day, they are in school who are non-stop working with these kids. So kudos to them. And also, if there are any other teachers, any other caregivers on this platform who work for the special need kids, again, very, very thankful to all of you who are providing such kind of services.
Thank you, Alka. So since we have just few minutes left, let's go to the questions. One question that Supriya asks is, may I know the kind of yoga you are doing with kids, and what's the theory behind yoga changing behavior? Is it about core strength or more than that? So either Arunatai or Madhumita, you can answer this question.
Madhumita, you want to go first?
Sure. So I started doing it with a regular Srijit yoga, but I quickly realized yoga helps to strengthen the body, which in turn strengthens the mind. And it helps in the cross-brain connection between left and right hemisphere, which is at the very base when you go about primitive reflex integration and mind-body control and everything. So yoga is the very base of all the other therapies that people mention.
Yeah, yoga definitely helps core strength development, mind, body. So I agree with you. That is very important in all the respects of the bodily functions. Mind, spirit, and breathing.
And
breathing is also, we are learning to breathe at that time.
Pranayama helps in stimulating your brain and connecting your left and right hemisphere. And beyond that, what I noticed is strategically planning the yoga poses to address the very specific area that you want to work on is the key.
Yes, I agree. What is the next question, please?
Yeah. So Madhav Kaka says, I know someone whose son is autistic and she's so stressed that almost she also needs some therapy. So can you talk about how parents of autistic children can take care of themselves? So basically, as caregivers, how do they make sure that they are taking care of themselves?
Yes.
Madhumita, yeah, and also Madhumita, I was also very curious when you described, thank you first of all for sharing your own personal story, and with 2 kids having unique needs, we were wondering, how do you take care of yourself?
I don't take them, I just snatch it from them.
Thank you.
I would say Madhumita is amazing in terms of handling the kids. And I've seen her in the yoga sessions, helping the kids, both the younger one and the older one, and
Yes,
she's just amazing, and we keeping the
incredible.
calm mind. Yeah.
Yeah, she
coming back to the
when in
topic-
yoga session, she usually helps with all the poses. And she had mentioned that can you repeat it more often? So when she's taking yoga with me, I usually repeat it 3 times and go a little bit slow so she can try to adjust the pose correctly. And it really helps them because and sometimes I feel that I should have a one-on-one individual session with him or when any autistic kids, so that will help them to have the correct pose and learn to breathe at appropriate time and excrete at appropriate time. That definitely will help. Pranayama along with breathing is so important with yoga poses also. So I think Madhumita, you will agree with that.
I would like to, yes, I totally agree. I would like to interject in here. So when the person asked about self-care, is to have a routine. So if you are setting up, you obviously for any autistic parent, you need 48 hours in one day to cover up everything. But the key is to have a routine. If you do one set of work for today, do another set of work for tomorrow and organize your schedule in such a way that you have time for yourself at the end of the day, or at least once or twice every single weekend. You don't have to go out. You can just take your time and practice mindfulness as a part of the BMM meditation. That helps to keep you sane in the chaotic world.
Yes, meditation definitely help. Asking, discussing with the parents. Keep some time for yourself, going out for a walk or spend some time with you, go for outing and discussing with parents and ask for professional help. That is going to help relieve the stress and try to have the emotional balance. Because if you are balanced, your mind is calm and quiet, then you can do many other things. You can learn things, you can teach children also appropriately. So a lot of resilience, calmness definitely help with this situation. And really I admire Madhumita for that.
Thank you. Rakesh Bhatt has their hand up. You have a question?
Well, I noticed that some of the announcements were in Marathi, which people like me could not understand.
Yeah, so this is a Bruhan Maharashtra Mandal group, and so generally our programming is all in Marathi.
Okay.
And so she was just announcing next week's session announcement and the topic for that.
Okay.
So since that session is going to be in Marathi, she announced it in Marathi.
I have a
We
question.
understood. Thank you so much. And I appreciate the whole talk.
What
Thank
oils
you.
are recommended for Indian cooking?
Nayan has one question, I think.
Yeah, Nayanji, go ahead.
Okay, my question is, how much is not only mother which involves with this child?
Correct.
So as a father, what can we do?
That's a great question.
Very good question, because they are working.
Yeah.
What they need to do is support the mother, and of course get involved in the care of child's care also, because then you know exactly what is happening. So maybe you can divide some duties and take care of the child, so the mother will get some time off.
Yeah, she need a break. I mean,
yes, she needs a break. So definitely they need to be involved. There is Madhumita. How about you? Is your husband is also trying to help?
Both me and my husband are very involved, and we try to take turns. So my husband is more on sports, so he takes him out for practicing tennis and other outdoor sports, and take him on cricket whenever there is a chance. Now that he's not going to always play cricket, but that exposure gives him that idea of how the community works.
Yeah,
and that gives me break.
Yeah, so that's what it is. It's a balancing. It's balancing the life, balancing the diet, in general, even balancing the emotions. Everything goes in the balance. Yes.
What happens when the husband and wife do not agree with each other?
Sorry?
When they don't agree with each other's point of view.
We can agree to disagree and be respectful for each other's choice.
So, because we have no time left, we will have to stop here. Thank you very much, Aruna Navathe, for sharing this.
There is
valuable
one last
information.
question I want to answer. It's about the oils. About Indian oils for Indian cooking. Usually, I'm using olive oil, and I'm mixing olive oil with little bit of canola oil and little bit of avocado oil. And then I'm using that mixture. And avocado oil has a high temperature. So if somebody wants to fry, they can use, and canola oil also. Olive oil, you have a low temperature, you really cannot fry anything in it. So for any vegetables and everything, I use olive oil. But if it is frying, if I hardly do frying nowadays, but you can use avocado oil or even corn oil, vegetable oil. There are a lot of different opinions about these different oils, but this is my recommendation, that I'm mixing these oils and see how it works for each individual, and go on from there. Cold press oils definitely makes a difference, because one of my friend husband has dementia, and she thought that peanut oil press, so she bought the machine and used the press machine to press the peanut oil, and she has been giving that, and that person is very, very stable. The dementia has not gone up or increased. So I understand the importance of cold press oils. If you can get hold of cold press oils, it is beneficial for everybody. So that is my 2 cents about the oils.